Hello. You may have heard that many communities in the United States are experiencing an epidemic of prescription drug abuse, particularly opiate painkillers, drugs such as OxyContin, among many others. This usually shows up first in the form of overdoses, young folks brought to the emergency room in a coma and having to be revived, or in some cases it's too late to revive them. The causes of this epidemic are not that mysterious. In the first place, although they're absolutely essential to medicine, these are dangerous drugs. That's why they're controlled substances. They carry risks. They're addictive, and have been a problem really throughout medical history. There are a couple other factors that are important. One, people tend to regard these drugs as safer than street drugs, although they're acting on many of the same brain systems. They come in nicer packages as pills or capsules, and I think that fools some people into a sense of confidence. Second, they're a lot more available than they used to be. I'm told that in the last 2 decades, prescriptions for opiate painkillers have almost tripled because doctors needed stronger medications to treat chronic pain patients. In a sense, this epidemic that we're experiencing now is an unintended consequence of that increase in availability. I should define a couple of terms you may hear. Prescription drug misuse refers to employing the drug outside of its intended purpose. For example, if you use someone else's prescribed painkillers. Abuse refers to when that use causes actual problems, usually with reference to your functioning or your safety, such as operating a motor vehicle while under the influence, or taking too many of them so you stumble and fall, or even mixing them with alcohol, which is probably the most common problem and the common reason for difficulties that arise with the use of these drugs. Dependence is a medical disorder in and of its own right. It usually features tolerance, which means you need to take more to get the same effect that you used to get from a smaller dose. Withdrawal, which are flu-like symptoms such as nausea and vomiting, irritability, and of course craving or drug hunger for the drug when it's not available. If you're concerned that one of your loved ones has a problem or is misusing opiate painkillers, you can go ahead and contact the physician or somebody in the physician's office, like an office manager, and tell them what you've observed.